Hello, everyone, and welcome, and thank you for tuning in to Health Leaders, the place for peer-sourced and solution-focused insights for healthcare executives. My name is G. Hatfield, and I'm the nursing editor for Health Leaders. Today, we're talking to Deana Sievert, who is the Chief Nursing Officer at Ohio State Wexner University and Ross Hart Hospitals, about how CNOs can help create healthy work environments for nurses. So, hi, Deana, how are you?
Hi, I'm good. Thank you. Thanks for having me here today. I appreciate it.
Of course, thanks for taking the time. So let's jump right in. What do you think are the qualities of a healthy work environment for nurses?
Yeah, it was really when you sent me, the question. I was very interested and spent quite a bit of time of reflecting on that because I think, we've talked about healthy work environments for so long. The AACN has done an amazing job of really pushing that agenda now for decades, really. And so I really, spent time thinking about that, and a couple of things that really kind of popped into my head where I as I'm talking to the teams where I feel that it really sits is a couple of key things. So first of all, I think our nurses very much feel like when there is that healthy work environment, they're really pushed and get to work at the top of their licensure, right? And when we talk about having that meaningful, purposeful work that they need in order to have that healthy work environment, I think being able to practice at top of licensure is one of those key things.
Hmm.
Some of the other things are probably a little bit more common that we think about across the board with healthy work environments, having that respected voice as part of the team. And I think that that's not just on those front lines, those first lines, whatever term that you like, but with that team, it has to be from the C-suite and the top of the organization in the
Hmm.
boardrooms all the way down, right? That has to be saturated throughout the organization. That nursing has that respected voice just simply because of the impact that we have on patient care and then
Hmm.
the volume of our team members that exist in the organizations. Obviously, with that, shared governance models are critical. The engagement, if you have a highly engaged team, then I definitely believe that the workplace is definitely healthier in regards to how everything is approached. I think an engaged team is really the key to having a very healthy work environment. If they're not engaged, I don't even think that it's even an option then to have a healthy work environment. And then I think, thinking a little bit more around like the safety work and all of that, I find that healthy work environments, they have appropriate escalation pathways, right? And that could be for anything. That could be for, hey, I'm concerned about this specific patient, with the care being provided, and I think we need to escalate that, all the way
Hmm.
over to something as broad as, hey, we're getting behind in recruitment, and we think that we need to escalate the concern that maybe we're not quite as competitive with our wages as we were 6 months ago.
Hmm.
And so I think a healthy work environment is also reflected by the ability and amount of escalation pathways that our nurses have in order to be able to solve problems. So, and then of course, just being appreciated and in a very meaningful way that is reflective of me as an individual. So, very long answer there. Sorry about that, but
No worries.
it was. I think those are the ways that I connect with healthy work environments.
Absolutely. And you mentioned the American Association of Critical Care Nurses. And for our audience, they have 6 standards of a healthy work environment, which include skilled communication, true collaboration, effective decision making, appropriate staffing, meaningful recognition, and authentic leadership. And I wanted to ask what your thoughts on those were.
Yeah, so I think honestly, our colleagues at AACN have done an amazing job of really trying to capture those buckets, right? And
Mhm.
that's a task to capture what are the parts of a healthy work environment, and I think that they've done a really nice job. And the thing that I appreciate about the development of those 6 standards is that they've also put out meaning behind that and how
Mhm.
you can accomplish those things. And so I think they've completely nailed it in regards to, those buckets. I think that the one thing that I might offer is that, times continue to change and healthcare
Mhm.
continues to change. But so far, they've definitely connected with that, and so I think they are spot on, and I like the buckets, and I find myself as a nurse executive leader really working inside of those buckets, to really advance the healthy work environment.
Absolutely. So, since you said times are changing, is there anything you would add to the standards specifically?
Yeah, I don't know if I would call them out as specific standards, but I
Mhm,
definitely think maybe where there's opportunity to amplify, maybe
mhm,
within those buckets, or maybe it is a separate bucket. I came up with two, and they're kind of the things that are very hot in the literature right now, hot in, in the public cries for assistance in nursing, and
mhm,
and it is around, the one I thought of was, focusing on self-care and well-being in the
mhm,
work environment, right? I think
mhm.
so much of the well-being work is around, oh, hey, when you get home, don't forget to focus on your well-being, right?
For
And I,
sure, yeah.
yeah, and I think we could do a better job of incorporating that into the day-to-day work and the environment, and into that whole work environment, and creating that healthy work environment with a heavy focus on, listen, we've got pathways while you're here at work. If you're stressed, you come in the morning and your stress level is, high because the morning didn't go like it should have at home, we can help you here. And so that might be in one area that I would think that maybe we could put a little bit of attention on. And then the second area is something that I know we're all really struggling with is, the workplace violence,
Mhm,
things. And, and I think that it would be great if we could call that out maybe a little bit more. I think there's certainly pieces of those two things embedded into those six standards for sure. But
mhm.
just with the times that we're in right now, I almost wonder if maybe it isn't important to amplify those two into maybe an actual standard.
Absolutely. So, what do you think are some of the outcomes of having a healthy work environment for nurses?
Yeah, I think the literature is strong on this. When you have that, that healthy work environment, obviously, nurse, your nurse retention, your nurse recruitment are all enhanced. Other tangible types of things, the patient outcomes, obviously, when
Mhm,
you've got that healthy work environment where nurses feel comfortable escalating care concerns, where they have that voice, things like hospital acquired conditions are, the research shows they improve. And so, I think those things are all very tangible. I think fewer safety events is definitely
mhm,
another thing that we see when we have healthy work environments. But, I think it goes beyond kind of those tangible things, kind of those things that we just feel. I think, when you have a healthy work environment, your nurses feel safer, your
mhm.
patients feel safer. You've got, that whole body of teamwork that really connects and moves things forward when you have a healthy work environment. Um, and I have found in my career that when I have work environments that are healthier, I've got a much stronger connection with the frontline teams, and they to
Mhm,
me
mhm.
as the chief executive, and the chief nurse executive. I feel like those lines are strong when we've got those healthy work environments, and that honestly is just one of those things that when you have that, it makes all of our jobs easier because you've got that bi-directional flow of communication, which really helps.
Absolutely. I was going to say it seems like communication is the key factor within all of this. So, how do you think CNOs can improve conditions for their nurses so that those outcomes can be achieved?
Well, I think that one of the core principles, I know in my work is that I represent myself as their voice in all the meetings that I'm in every day, whether that's, sitting with executives, whether that's sitting with, our directors and managers, or whether that I'm sitting in a boardroom, right? And I think that as chief nurse executives, we take that seriously.
Hmm.
And so it's definitely about being their voice because they don't get that opportunity to have that. And so they rely upon that CNO role, that CNE role to be able to be that voice. But in order to be successful at that, right, you've got to have that connection with the frontline staff to ensure that you've got, the things that are important to them
Hmm.
and the things that are impacting their work where they need help, the barriers there. I've got to have that connection with the frontline teams so that I'm representing them the right way. And so I
Hmm.
very much think it's about that representation, but then also ensuring that you're connected in order to make sure that you're representing them the right way. And then kind of with all of that, I think one of the things that maybe we're not so good as leaders is making sure we're going back and closing that loop with our frontline staff to say, hey,
Hmm.
I had the board meeting this past week. Here's what I presented to them. Here's what I talked about. So I wanted to let you know, and I'll keep you posted as we go through. And I think that I think making sure that you close that loop, because otherwise, I think our staff lose faith in regards to what we're actually advocating for and what we're working on. And so closing that loop, I think, really is part of it. So those are kind of the three buckets when I'm doing my work that I kind of think about.
Absolutely. Yeah. Closing those feedback loops is a great piece of advice for sure. So my last question is what resources do you think CNOs are missing throughout the industry that you think would help to create a healthy work environment?
Yeah, I think, I thought about this question quite a bit too, because, honestly, I hate to say it, but I think we could all say we need more time.
Hmm.
And
Yeah.
I think obviously that's nothing that can really be provided, but just having that time. I find myself breezing through my day, meeting after meeting after meeting, and when is that time? I'm finding that time to really carve out to be able to, just stop and think, and really be able to then put put the plans together and connect all the dots. So I think that's obviously one, but again, I don't think people have the ability to maybe make that happen. But
Mhm.
the other thing, though, is I think that one of the resources would be just to have the support and ability that allows me to invest and then reinvest in our first line teams.
Mhm.
And certainly that's a little bit of a challenge right now, given all of the as margins continue to decrease in healthcare. But I think there are innovative ways that we can do that, right?
Mhm.
I can invest in my team and reinvest in them, just like we talked about, by representing them, but then closing that loop and getting that feedback from them. And so there are definitely strategies as a chief nurse, officer that I put in place to help me to ensure that I'm able to invest and reinvest in my teams. And then, the other one that I kind of had come up with is, really carving out time to be innovative, but
Mhm.
doing that work with our frontline nurses. You know, we all know that nursing has a very long history of innovation and creativity and problem solving. And I think it's amazing when, if you can just get a small group of nurses together with some nursing leaders and just say, guys, here's the problem. Let's focus on what we're trying to solve. And being able to carve out that time, I would encourage every nurse leader to carve out that time with some of their team to be able to solve that. So those were my couple of things that I would recommend.
Absolutely, yeah. I could not agree more on the not having time to just sit down and think. I feel like that's always a problem everywhere. But yeah, well, thank you so much, Dina, for your time. I'm really grateful to have had this opportunity to get to know you and hear your insights. And thank you so much to our audience for listening.
Thank you. I appreciate it very much.